Ladies and gentlemen, today we're going to talk about how to perform an intramuscular injection for health section. Now, an intramuscular injection is a shot of medicine given into a muscle. Certain medicines need to be given into the muscle for them to work correctly. What should we know about the syringe? Well, there are three parts in the syringe. We have the needle, the barrel, and the plunger. Now, the needle goes straight into the muscle. The barrel holds the drug and has markings on it, like a ruler. And markings are in milliliters. The plunger is used to get the medical solution into and out of the syringe. Now, which are the right and safe areas we can give an intramuscular injection? Well, number one, we have the vastus lateralis muscle, or the thigh. Look at your right thigh and divide it into three equal parts. The middle third is where the injection will go. The thigh is a good place to give yourself an injection because it is very easy to see. Now, it is also a good spot for children younger than 3 years old. Number two, we have ventrogluteal muscle or hip. Now, have the patient lie on his or her side. To find the correct location, place the heel of your hand on the upper outer part of the thigh where it meets the buttocks. Point your thumb at the groin and your fingers toward the person's head. Now form a V with your fingers by separating your first finger from the other three fingers. You will feel an edge of a bone along the tips of your little and ring fingers. The place to give the injection is in the middle of that V. The hip is a good place for an injection for adults and children older than 7 months. Number three, we have the deltoid muscle or upper arm muscle. Completely expose the upper arm. You will give the injection in the center of an upside down triangle. Now feel from the bone that goes across the top of the upper arm, and this bone is called the acromion process. Now the bottom of it will form the base of the triangle. The point of the triangle is directly below the middle of the base and about the level of the armpit. The correct area to give the injection is the center of this triangle, 1 or 2 inches below the acromion process. Now this side should not be used if the person is very thin or the muscle is very small. And number four, we have dorsogluteal muscle or buttocks. Expose one side of the buttocks with alcohol wipe. Draw the line from the top of the crack between the buttocks of the side of the body. Now find the middle of that line and go up 3 inches. From that point, draw another line down and across the first line, ending about halfway down the buttock. You should have drawn a cross at this point. In the upper outer square, you will feel a curved bone. The injection will go in the upper outer square below the curved bone. Do not use this side for infants or children younger than 3 years old. Their muscles are not developed enough. So, how do I choose the best place for an intramuscular injection? Well, keep track of where the injections are given. Make a list of the sites that you are using. Write down the date, time, and the site each time you give an injection. Then change the site for injections. So this helps preventing scars and skin issues. The sites where injections are given should be at least 1 inch away from each other. What items do I need to give an injection? Well, you need 1 alcohol wipe, 1 sterile 2x2 gauze pod, a new needle and syringe that are the correct size, of course, according to the injection you have to give, disposable gloves, if you have them, they're not really necessary. How do I give this injection? Well, number one, we wash our hands with soap, and if necessary, we put gloves on. Then we open the alcohol wipe. Then we wipe the area where we plan to give the injection. We prepare the needle. We hold the syringe, pull the cover off with our hand. We place the syringe between the thumb and the first finger, and let the barrel of the syringe rest on our second finger. Now we hold the skin around where we will give the injection, and we gently press on and pull the skin so that it is quite tight. Then we insert the needle into the muscle. We hold the syringe barrel and use the wrist to inject the needle through the skin and into the muscle with a 90-degree angle. Then we check the needle. We hold the syringe so it stays pointed straight in, and we pull back the plunger a little to make sure that we did not hit a blood vessel. If blood comes back, then we remove the needle immediately. We should not inject the medicine at this point. We dispose of both the syringe and the medicine in this case. We get more medicine in a new syringe, and then when we give the second injection, we give it on the other side. And then in the end, when we are sure we did not hit the vessel, we can inject the medicine. We push down the plunger to inject the medicine, and we do not force the medicine by pushing hard. Some medicines can actually hurt. As a general rule, we should inject the drug slowly to reduce the pain. Then we remove the needle. We place the gauze in the area where we just gave the injection. And how do we get rid of this syringe? Well, we should check the local requirement for getting rid of this syringe and needles, because they may vary according to the area, the location. What are the risks of intramuscular injection? Well, basically infection, bleeding, numbness, or pain. When should I contact the caregiver after I try to give an injection? Well, only if I see any fever coming up, sneezing or coughing after this injection, if there is a lump, swelling or bruising in the same side of the injection, or if we have any questions about how to give intramuscular injections, although we should be good with that. When should we seek for immediate care? Well, if we see rash or itching, shortness of breath, or mouth, lips and face swells. I hope this video has been helpful for you guys. If you have any questions, email me at raf.pilla@gmail.com. Again, raf.pilla@gmail.com. And thank you for watching.